Okay?
Yeah.
You will see.
Yeah. Hello, doctor. Good morning. I just want to discuss about my symptoms. I having 2-3 times of migraine attack. I don't know. Even if I take paracetamol, still it's not relief. I'm having a blur visions, not able to see the things or any person properly. Even I take 2 times or 3 times of paracetamol, it's not even like helping me to get it out. So what can I do for?
So this 2 to 3 times attacks, that was in a span of how many days?
Like 3 days continuously.
3 days continuously.
Yeah.
So do you get like frequent attacks?
No, not yet. This is my first time.
Okay, you should not say first time.
Okay.
You should say I get like frequently.
Okay.
Twice a week.
Okay, twice a week.
Then only we can come to preventers, no?
Okay.
We'll have to restart.
Yeah. Did you understand?
Okay, I understand. Actually, I just want to discuss about my symptoms.
Voice is pretty clear.
Yeah.
I was very tight so far out.
Paracetamol, still it's not really having it.
Every week I get 2 weeks. It has been going on for the last 1 year. But it never goes away with Panadol or something like that.
Panadol, paracetamol.
A paracetamol, use paracetamol.
So what can I do?
So this 2 to 3 times attacks, that was in a span of how many days?
Like 3 days. Okay, I thought this is my first time. I can say like this. I thought like.
No. For first time, you don't need
Yeah, then it becomes less important.
Okay. Okay.
Okay.
Hello, doctor. Good morning. Actually,
Hi.
today I just wanna ask about my symptoms of having frequent attacks, like 2-3 times of migraine, and also blurry visions, not able to see the things properly. Even I tried paracetamol like 3 times or 4 times in a day, still not able to get rid of it. What can I do for that?
So this 2 to 3 attacks was in a span of how many days?
Actually, monthly I will get 2-3 times, and sometimes past 1 year I will get in this.
Past 1 year,
Yeah.
so monthly 2-3 attacks at least,
Yeah.
right? They say that paracetamol is not going away,
Yeah.
getting again repeated attacks. So what you must understand is, paracetamol is an acute symptomatic medicine. That is, if you have a pain right now, you take up paracetamol, you'll get relief. But it's not a preventer. So if you get frequent attacks, you should be on a preventer. I think Sir will tell us more about the preventers.
Yeah, see, the point is migraine is by and large not a serious condition, right? But then what happens, people tend to underestimate its importance, right? So we should have a balanced understanding. Firstly, it's not going to cause any long-term damage to the brain or lead to stroke, dementia, tumor, clot and all that, right? This is something people keep asking me. I hope I don't develop this or that. So first point is, it's not like that, but then migraine can cause serious disability in life, in the sense that you may land up in the emergency room with severe headache, vomiting. You may have to take break from work, medicines may stop working, things like that, right? So what you're facing, I feel, what you're facing is that because of inadequate treatment, you've been relying only on one medicine, one strategy, and then you landed up in a situation where the migraine episode is not ending. What you need to do is you need to treat each episode, but when you need frequent treatments for that episode, you also need to take preventive treatment, right? So take more effective treatment. Paracetamol is effective only for the mildest attacks and initially, but as you go along in life, paracetamol may stop working. So you may find that you need a more effective treatment for the acute attack. Plus, if you are frequently using it, you need some preventive treatment. Frequency is a very important criterion. At least, if you're getting more than once a week, I think it's better to be on a preventive treatment. Otherwise, you'll end up like this in the hospital with injections and a lot of trouble. Okay? Does that answer your question?
Yes, doctor. But what preventive medicine we can take?
Well, there are many options. We choose based on what is best suited for you. For example, if you're not sleeping well, then I generally choose topiramate. If you have any side effects related to it, people don't like, that slight sleepiness and that effect, I use beta blocker. Like that. There are many options. There are more new options actually. Right? So we'll discuss that in more detail in future.
Sir, is it true that beta blockers should be used with caution in young males? Anything related to sexual dysfunction or anything like that for beta blockers?
Well, I think it's a concern. People do have this, but it's more theoretical. I have not seen it much, right? I feel beta blockers tend to be, in terms of side effects, they tend to be much better. People, it has
Cardiac
almost,
savings.
yeah, none of the major issues. Whereas with some other medicines, sometimes people have issues of either weight gain or weight loss, or abnormal sensations in the hand, things like that, or sleepiness, which is a big concern.
So what about valproate? Do you regularly use valproate?
Well, I have been using it as a backup only, because when somebody is not, responding to the other medicines or had side effects, sometimes people have asthma, can't give them beta blocker. I tend to avoid valproate in women generally, especially those in the, pregnancy years when they can potentially be pregnant, things like that. So, and valproate has far too many issues, right? Weight gain, fertility issues, facial hair growth, so many things to happen. Tremor, I've seen a lot of people with tremor following sodium valproate. So I tend to use it as a sort of last resort. Yeah.
So basically, when somebody comes with migraine, the preventive treatment that you usually resort to is either beta blocker or topiramate.
Yeah.
Okay, so I have been hearing a lot about this new treatment that is the injectable preventive therapy. Could you tell us more about it in the next video?
Yeah. Yeah, we'll discuss more in detail about these things. Yeah. Okay.
The next video is I know later.